Assalamu alaikum wa rahmatullah. Welcome back to Medic-Hour, second segment. The first segment, a lot of discussion surrounding the coronavirus and the meanings of many terms that we hear in the media. For example, epidemic, pandemic, and the differences between coronavirus, swine flu, and the Ebola that we have heard in the past, and how we should tackle coronavirus, what we should do, what are the are we following the advices given by government. This very segment, I want to talk to the doctor about the governments that are doing and ordering the lockdowns. Is it to control people and take away the freedom that we hear on social media all the time, or is it for some other reason? So let's go back to our resident GP, Dr. Asim Farooq. Thank you so much for being on the show in the second segment once again. So coming back to the question, the governments are doing the lockdowns. Of course, I understand, we know for our own benefit, but what we hear on social media to take away our freedom and to have some kind of order on us.
Yes, and again, this is important. You know, we don't want to be shouting out that they may take our lives, but they're not going to take away our freedom.
Yeah.
And obviously, this is not a conspiracy by the government to take away your freedom. Ultimately, they are trying to follow the World Health Organization's guidance and also trying to follow examples that have already been shown to us in countries where, you know, you will find the numbers will go up and up and up. Okay, yeah. So you can imagine it goes up, it doubles every 3 days, up and up and up. Okay, so if you just let people just mix with each other, you are going to be faced with a massive amount of cases. So what they looked at was, how did China, you know, what did they do to it? And what did South Korea, Japan, what did they do for it? They went into harsh lockdown mode, and it massively reduced the cases. Mm-hmm. So these are the reason why they went into lockdown. And we know that, you know, although, you know, in the UK where, you know, we love our freedoms here, that they were slow in implementing this because they wanted to give us our maximum freedoms possible. But they found that actually they had to do this in the end. They knew that by doing this, it's going to have a massive detrimental effect on the economy. Mm-hmm. You know, we've only just worked our hardest to get out of this big recession, and now we're going to face the biggest recession ever. Why would anybody want to do that? Not just in one country, but throughout the world.
Yes.
It wouldn't make any sense. We have what's called gross domestic product. You know, the government expects every citizen to be contributing something towards the economy. And therefore, how can we do that at the moment? Not only that, we're having to take money off the government right now while they furlough us. So that's another thing. So it would not make any sense to do this. And also, we know that once the lockdown mode is over, it will all open up again. Potentially, it may be the social distancing will stay, but they're not going to say, well, you have to be locked down forever, because there has to come a point. So this is all very important. And I think ultimately, you know, I'm sure the government also realizes there are other negatives with the lockdown. We know the detrimental effect it's having on education, all right? I'm afraid my kids' education now is watching cartoons on Netflix.
Yes.
Okay, Zakaria, stop that. Yeah. Now, ultimately, you know, we need to realize that.
Yeah.
And I think that, you know, the education is vital. Yes. My son was about to do his GCSEs. Can't do them at all now.
Can't do them at all. Okay,
he's going to have to rely on his mocks.
Yeah.
And being a boy, obviously mocks don't always tell the true reality of what he could have been capable of. So again, it has its effects. You know, we know mental effects. Again, you know, although, you know, the Asian Muslim community, we don't talk enough about mental health, but it has going to have a negative effect mentally. We've heard stories about people even committing suicide because of the effects of this isolation has had on them. So again, very, very important. So, you know, there's so many economic downsides to doing this that why would anybody lock down unless they absolutely had to? So I think we need to realize this, that, you know, this is not the reason for the lockdown. It was not to take away our freedoms, you know.
Do you get, as a GP, people coming and complaining about this?
Absolutely. And of course, you know, just going back to that point, the biggest excuse before for government taking away our liberties was terrorism.
Yes.
But terrorism seems to have disappeared.
Yes.
You know, now we've got viral terrorism instead, which again we'll talk about the conspiracies behind that. But it's gone away. Suddenly people aren't fighting each other.
Yeah.
You know, suddenly we've forgotten about that.
Yes.
So that's great. So, you know, this is not going to be that. So people are obviously trying to come up with their own theories. And, you know, I mentioned this in a previous post that people can go into almost like an ostrich mode, where they hide their head in the sand and just ignore what's going on around them. When there's too much negative things around them, they just ignore it. Or they'll come up with a counter argument, which may not make any real sense if you really think about it, but they'll just believe in it. You know, it goes against reality, doesn't it?
Yes.
To come up with all these ideas. If you stop and think about it, then obviously you'll realize it doesn't make any sense.
Well, you start getting depressed.
Yes.
To be really honest, I mean, you hear so many different things from people, and I think social media has, of course, made it even worse.
Yes.
And so many videos, audio recordings going around in WhatsApp, in Facebook, all over.
Yeah.
And I tend not to kind of ignore all of that and just keep myself to myself and take each day as it comes. I find that very, very beneficial indeed. I'm sure you waking up in the morning and going to the surgery is a normal thing, you know. So I'm sure you get people coming to your surgery and say, you know, they're living in abnormality now.
Yep.
You know, it's not a normal lifestyle. So what do you say to patients like that, and, you know, people thinking about suicide? Have you had patients like that?
Absolutely, absolutely. You know, even, you know, we all know suicide is not meant to be allowed in Islam, but ultimately people still do it because they become so depressed, so isolated, and obviously anxiety becomes a big problem because, you know, many of us, you know, won't be so anxious about it, and then we will just not care at all and take risks. So we've got to balance that out between being super anxious about everything, you know, and ultimately, hopefully, you know, in Islam, you know, we will get that right balance, you know, and I think that's important. But I think the important thing is that, you know, you right now have to get used to a new kind of lifestyle, a new routine, you know, and I think it's important that you still wake up at the correct time, you know, you still go to bed at the correct time, and you have a plan for the day. Otherwise, you know, you will lose all sense of that routine. I think that's very important. Another thing I haven't quite mentioned, wash your hands repeatedly. You know, somebody said to me, well, once I'm in the house, I don't need to wash my hands again. But you are always touching things. It's important to get into that habit of washing hands.
Yeah.
And again, we can do a further video or something about how to wash hands correctly, you know. Utilize that example when, you know, Boris told us that 20 seconds means saying happy birthday twice. And a practical advice I have is you often find yourself, let's say washing your hands, you turn on the tap, squirt on some soap, bang, 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 water, done. That's probably just a few seconds, isn't it?
Yeah.
What I do practically, I wet my hands, put it on, then actually close the tap, because then you concentrate on making your hands properly lathered up with soap, and spend that 20 seconds. And again, you will realize all the different parts of the hands that need to be covered for the soap. Again, you can look that up, okay? But sing that happy birthday to yourself, you know, at least it'll make you cheerful, singing happy birthday to yourself, you know, 10, 15 times a day. And then, you know, maybe even give yourself a present, you know, as long as it's healthy, you know what I mean? And ultimately, you know, then washing it off. Again, very important. So again, everyone realize that, wash hands properly all the time. And also, I want people to stop touching their face.
Yes.
A very common thing. Again, you know, I touched on it briefly about pros and cons of gloves. You know, gloves, you know, can have negatives because if you walk around all day with gloves on, you've accumulated all that stuff on your gloves. Your gloves now have got more dirt and rubbish on them than if your own hands, which have got their own natural bacteria, would have fought it off, or that you would have washed off regularly as well. And then when you then get home, you have brought it in. Or when you take those gloves off, you then touch the gloves and put it on your own hands. That's another problem. So again, this is the important thing about gloves. And what also happens, you've touched things with your gloves, and then you accidentally, like all of us do, touch your face. It's been shown that people touch their face 20 times an hour on average.
Whoa.
Some people more, some people less, you know. All right, so that's important. You don't even realize you're touching your face. So realize you are touching your face and stop doing it. I think because that's the thing, because if it gets into what's called the mucous membranes, your mouth, your eyes, your nose,
Sure.
that's when the real trouble starts.
Got it.
You know, that's when it really gets hold inside your body, all right? Because this thing lives in the mucous membranes, in the nose, in the throat, in the lungs. We got to stop it from getting there.
Sure.
All right? So that's why it's so important to avoid the droplets, so coughing and sneezing obviously, and also washing your hands all the time, vitally important.
Absolutely. Yes. Doctor, we've got a call. Do you want to take one?
Sure, let's take a call, yes.
Okay, cool. Let's see who we have. Assalamu alaikum. Hello? Caller, you are live? Hello? We cannot seem to get through.
Assalamu alaikum.
Wa alaikum salam.
This is Tamkin Riyaz speaking. Assalamu alaikum, everyone.
Wa alaikum salam.
Thank you very much for such an interesting factual program and great advice. My thing is immune system. How can we boost our immune system so we are less likely to catch it, or if we do catch it, our immune system to deal with it? Thank you very much.
Excellent question.
If you can repeat, I didn't quite understand.
Yeah, how can we boost our immune system so we then become less likely to capture this?
Okay, fine. So hopefully we're going to cover some of the things that can help you and not help you necessarily. Now, if we just for a brief minute talk about the things that are not useful that people are doing.
Yeah.
Okay? Do not gargle with bleach.
Whoa.
I cannot believe I have to tell people that, but they are doing this.
Okay.
So please stop gargling with bleach. Number 2, hot water does not kill the virus. Drinking hot water does not kill this virus. That doesn't make any difference. By all means, drinking hot teas and things helps soothe the throat, but does not necessarily kill this virus. Okay? Also, hot air does not kill the virus.
Right.
I've seen things circulating that you should use a hot air dryer to dry your face, get some nice bristles on your beard, and mashallah, you will look good as well as kill the virus. Again, that does not work.
Sure.
Okay, so these are some of the things that do not necessarily kill this virus.
Yeah.
Now, in a similar vein, I want to mention that taking things to help the immune system may or may not boost the immune system and kill it when you have it. By all means, you can try, but it's important to boost it before you get it. All right?
Right.
Because the problem with a lot of these things, which is vitamin C, vitamins A, C, D, and obviously we've heard about black seed oil and kalonji oil, that there are some studies as some of the positives, but most of those talk about prevention really. And I think it's important to then extrapolate that to the cure. And I think there's not enough strong evidence for sure that vitamin C, black seed oil will necessarily kill that. And also some of those evidences could be that they might help against bacteria, whereas a virus is your own body cells making all this stuff.
Yeah.
All right? So that could be a problem. And also I think it's worth remembering that the reason why some people do badly is actually their immune system might be too strong and overreacting. All right? So this is important. You know, we hopefully know by now that, you know, there'll be a few days where you'll have the virus in your system and not feel anything. And then you might start feeling some symptoms, and it might be 5 or 6 days before you feel anything.
Sure.
Then maybe develop the symptoms perhaps. And then normally they might start becoming really more unwell or breathless in the second week. And we've heard that from Boris. He's now day 9, day 10, day 11 now I believe it is, when he started getting worse, didn't he?
Yes.
So this is something we're commonly seeing. Okay, why does that happen? The body overreacted to the virus. Your immune system was too strong almost. You know, that could be a problem. Now again, maybe the benefits, like I said, are beforehand. Boost your immune system so you don't get it in the first place, maybe. All right? By all means, have some vitamin C, have some vitamin D. There is some evidence, maybe it's good. You know, have black seed oil. In fact, I've even bought some black seed oil. I'm trying to take it every day. But that's to prevent.
Yes.
You know, but to treat, it's going to be more tricky. all right? So I think that's very, very important that we need to realize that, okay?
Sure.
All right, so hopefully that clears up some of these things.
Yeah, definitely.
Yes.
Thank you so much.
Maybe, sorry, one other thing I want to mention. Sorry, I forgot to mention. Sleep. There's definite evidence getting enough sleep is going to boost the immune system, okay? That will help, you know, your what's called the natural killer cells, which will fight the thing naturally, as you can imagine, kill it. They will boost that. So we know that for sure. So by all means, get enough sleep, get enough rest. Very important. Get enough fluids generally, eat well, eat healthily. All very, very important advice to help treat this. If you want to take some multivitamins, A, C, D, and kalenji oil and black seed oil, by all means do that. But do not replace your treatments that the doctors recommend with those.
Sure.
Okay?
Very good. Now, so we spoke about masks and gloves. We spoke about that. So people, should they, I want to ask the direct question, should they wear it, the masks and the gloves, or if they do, how careful should they be?
Yeah, exactly. Now what I'd like to address very, very first of all is that, and this could be a downside, if we all go out and buy lots of masks and gloves, there's going to be a shortage.
Yeah.
And we on the NHS frontline who are going through these things are going to find it difficult. You know, when I went online to try to buy some of these things myself, because unfortunately the supplies have been very slow, I'm finding the prices are massively inflated. That's another story, and any businesses out there who are inflating their prices, please take that heed of that. But ultimately, there's a shortage, and obviously supply and demand. If you haven't got enough of something and everyone wants it, you can increase your prices.
Yes.
Now, if everyone goes out and buys them, there's going to be a problem with that as well. So now, that being said, is it worth, there has been some studies where they got people to just wear some sort of masks. And actually they showed that actually something is better than nothing. Yeah. By all means, cover your face, because obviously it'll stop some of the droplets, by all means. If, however, you are wearing even a surgical mask, thinking that will protect you and you've got a coronavirus victim in front of you, a surgical mask will not protect you against coronavirus, against you getting it, all right? The droplets and everything are actually smaller than that. They're smaller than 7 microns, and they will get through. And what also people are doing, they're not making a proper seal. They put a mask over their face, but they need to push it against their nose and push it right up under their face, chin and beard. You know, and sometimes the beard will stop the thing. I'm not necessarily advocating shaving off the beard, but some of my medics have had to shave off the beard just in order to fit the mask properly.
Yes.
Okay? So that's the other thing. If it's not fitted properly, it's not going to protect you. If you think it's going to stop corona, it's not going to protect you. Only some of the what's called N95 or FFP3 masks are going to protect you if you've got an active person. But if you go out and buy the N95s and FFP3s, they're going to be a shortage for us. So don't all go out and buy FFP3s. I'm sure a normal mask will be okay, or just normal, even a cloth is okay, but follow the social distancing rules. That's important. Put something simple over your face. That's important. You can do that. If you can get hold of cheap, normal masks, by all means do that, as long as it's not a shortage. So that's the important thing. Now, gloves, I've mentioned already. We've mentioned that if they go on your hands, you know, you're just isolating more, and don't touch your face with them, and learn how to take them off properly. All very, very important.
Take them off and just put them in the bin.
But learning how to take off gloves is actually a skill that you forget. You know, you would take off your gloves like this and like this, you just spread it back onto your normal hands. It's a skill you need to learn, and you should look at that up. Very important as well. You know, don't bring it into your house. Again, very important as well. So all these things are important. And as medics, we might use gloves, but we change it with each patient. You know, we see a patient and take it off. You know, so that way we then wash our hands before, wash our hands after. Again, if you don't wash your hands before and after, again, it's important. So gloves are not necessarily going to protect you. And I've said already, stop touching your face. Again, very important to not do that.
Yes, 20 times an hour. That's shocking.
Yes, exactly. Yes.
Well, that is shocking.
Exactly.
Okay, so you've covered. We've covered drinking lots of warm water or blowing hot air on your face doesn't necessarily work. We've spoken about that. We've spoken about face masks and gloves. That's good. What now coming? I want to ask these 2 questions that again swimming on in social media. That could this virus be a bioweapon created in a lab in China?
Okay. Now, I'm afraid a few celebrities have even jumped on this bandwagon, so shame on them for doing that. Obviously, one of the famous celebrities, some of us may remember who are old enough, David Icke, he's also talking about this. And when I looked into this myself, I said, there must be something behind this. Let's find out. But I think the first thing is to figure out, well, what are they trying to say exactly? Because there's differences. Number one, are they saying that 5G is making the viruses stronger? Are they saying that that is then making them spread wider through the 5G signals?
Yeah.
Are they saying that actually there's no such thing as of this virus? It's all made up, and everyone becoming sick is poisoning from the 5G mast. That's it.
Yes.
All right. And what then happens? We've heard stories of people going to 5G masts and trying to blow them up. Yeah. We talked about terrorism has disappeared. Well, I'm afraid against 5G it hasn't disappeared, has it?
No.
So it's important. You know, some people can do very silly things. And why have they said this? They said that Wuhan in China, where it all started, was the first city to adopt 5G. That's why they had it. But hang on a minute. The first city to adopt 5G widely was 18 months before Wuhan, London. London. Okay? Right. We were one of the last places to get it, weren't we? All right? So it's not that. Secondly, even in China, they adopted 5G in Beijing, Shanghai, all at the same time. They didn't have as much of a problem as Wuhan.
Right.
And also Iran, we heard about that early on. They didn't even have 5G. I don't even know what G they've got, 3G, 4G, 2G, who knows what they've got, yeah? All right, but ultimately, they haven't got 5G. So that too, sorry, I've touched my face there, sorry guys, yeah? But ultimately, yes, that's important because I think that blows it all out the water.
Yeah.
And also there was some evidence that they found that, bacteria communicate with each other with electromagnetism. Now obviously we don't know exactly how animals communicate, how the bacteria communicate. This is all up to Allah, He knows. Yeah. And maybe there's some traction behind that. But hang on a minute, bacteria and viruses, we mentioned it right at the beginning. They're completely different.
Different, yes.
Bacteria are living things.
Yes.
They have got their own power supply. They are able to multiply themselves. Viruses are dead things. They don't talk to each other, they don't communicate with each other. They're completely dead. Just like a seed. If you put a seed on the table, it will do nothing. No. But you put it in some soil and add some water, it will make something. Yes. That's an amazing thing. Doing nothing otherwise, think of the virus as the same. It's a seed. Something covered in a hard thing, just like a seed does nothing. But it's got something inside it which will make something happen. Sure. All right? And that's what I think. Imagine that thing going inside you, growing a tree, like Jack and the Beanstalk, and that could cause all sorts of problems. Yep. That's how I want you to think of a virus. It's not a living thing. So please stop spreading this thing about 5G. It does not cause this problem.
Thank you so much, Doctor. I wanted to also start talking about the positives of coronavirus, but we have no time, unfortunately. But what we're going to do, we will talk about this next week, same time, same place. I hope Dr. Asim Farooq has educated you enough on today's meanings of many terminologies that we see in social media and the news all the time, and when we read newspapers. I want to say a massive thank you to you for coming today, and hopefully next week we will continue talking about coronavirus and the positives, and we spoke about enough negatives, and there will be more topics other than positives which we will bring to you. So make sure you stay tuned for next week, and you tell others, go on social media, spread Medicawa and Dr. Asim Farooq and myself, and let's get some more calls in the last 10 minutes hopefully of the show. And who knows, maybe one day Dr. Asim Farooq will be here on his own doing his own show on Medicawa, covering many topics that benefits or that will benefit you and I and the vast majority of our communities. Thank you so much for watching today, and have a fantastic day and evening and rest of the week. Stay safe. Assalamu alaikum.